Endotracheal tube, it is an airway device which is inserted via the larynx into the trachea in order to attain a clear unobstructed airway for mechanical ventilation. The first successful intubation was performed by Sir William McEwan in 1978. A standard endotracheal tube design comprises of the following. First is the patient end. The patient end is a beveled tip which is facing leftwards, and opposite to this beveled tip is the Murphy's eye. The Murphy's eye will help to aid in ventilation when the beveled tip is blocked by a mucus plug. Endotracheal tube without the Murphy's eye is called the Magill's endotracheal tube. Second comes the curvature. The endotracheal tube has an anatomical curvature according to the oral cavity shaped with a radius of 140 millimeters. Then coming to the markings on the endotracheal tube, you have the level of the vocal cord, which is represented by a black line. Then you have a marking saying oral or nasal use. Then you have the manufacturer's name along with the internal diameter and external diameter in millimeters, and there is a radio-opaque line passing throughout the length of the tube. Material of the tube, it can be red rubber or latex, which is less traumatic, reusable, rigid, opaque material, but it is can cause allergy. Second is polyvinyl chloride, which is cheap, disposable material, transparent and pre-sterilized rigid pack, which is tissue compatible. Third is the silicone rubber, which is made of PVC plus silicone oil. It is opaque, cheap, reusable after autoclaving, and has less surface adhesions. Coming to the size of the endotracheal tube, adult male requires 8 to 8.5 millimeter internal diameter. Adult female requires 7 to 7.5 millimeter internal diameter. For children, like uncuffed tubes are preferred. Less than 6 years, age divided by 3 plus 3.5, and more than 6 years, age in years divided by 4 plus 4.5. There's a modified Coles formula which says more than 2 years, age in years divided by 4 plus 4. The external diameter is the same width as the distal phalanx of the little finger in children. For a cuff tube, you can use Kine's formula which says age in years divided by 4 plus 3. To choose the cuff tube, you have to reduce the size by 0.5 to 1 millimeter from the uncuffed tubes measurement. A size chart based on the age for uncuffed tubes is given below. Coming to the cuff can be with a pilot balloon or without a pilot balloon. Cuff with pilot balloon has a one-way spring valve, and a cuff without pilot balloon is either clamped or plugged. The cuff can be categorized into low volume, high pressure cuffs, which is seen in red rubber tubes. It can cause tracheal ischemia, stenosis, and scarring. Then there is high volume, low pressure cuff, which is seen in the PVC ET tubes. It has a larger resting volume and diameter. It can cause sore throat because of overfilling and nitrous oxide diffusion. The seal may not be as effective as the red rubber tube cuff. Then coming to the machine end, you have a male type connector which is 90-degree angulated, made of plastic or metal. Then coming to some special tubes, you have Coles tube, which is having a narrow patient end. It's used only for emergency neonatal resuscitation. It gives a high resistance to airflow. Second is the microcup endotracheal tube, which is a cupped tube used for children. It is soft urethane cup, which is situated away from the subglottic region. It has no Murphy's eye. Then you have RA tube, that is ring adapted Elvin tube. Oral south pole facing RA tube or nasal north pole facing RA tubes are available. It cannot pass a suction catheter. Then coming to the flexometallic tube, reinforced with a wire. It's flexible, non-kinking, used in neurosurgery procedures where there are head movements. There is no Murphy's eye and it is expensive. Microlaryngeal tubes is available in 4, 5, and 6 sizes. It's got a high volume, low pressure cuff. and it is used in narrow airway surgeries. Can be inserted through a LMA. Then you have an incubating LMA tube, which is reusable and wire reinforced. Then there is a Terran tube, which is silicone tube, a laryngectomy tube, which is J shaped with no bevel end and inserted through the tracheostomy. Then there are other specialized tubes like the endotracheal tube, the endoflex tube, the flexible tip Parker tube, which is having a flexible distal end. Then there is a endotracheal tube which has electromyogram reinforced, which is used to monitor the recurrent laryngeal nerve progress in during a thyroid. There are laser resistant tubes. There is a high-low evac tubes, which has got specialized suction channels, which is can suction above the cuff and even below the vocal cords. And there is a high-low jet tube, which is used for jet ventilation. It is uncuffed tubes. And finally, you have the double Lubin tubes used for lung and cardiac surgeries.